line, and we have some from operations as well too. So I'm going to do a bit of a high-level overview and kind of talk to you about the HealthiestYou, the service. I'm going to talk to you about how it's being sold effectively and positioned effectively out in the field to go out and at CornerStone to get you to attract more brokers to CornerStone, but then for those brokers to actually get into more clients, whether they're existing clients or potential clients and prospects, using HealthiestYou to get into doors, but then redesign the benefit plan to make them more money and then get more commissions for them and for CornerStone as well too. And then on the back side, I'm going to show you some of the tools that we have from start to finish. So how to prospect, some of the tools we have, marketing material we have, and then actually how to submit deals and how to go from the field. So I'm going to, there's quite a few of you on the call today, so I'm going to keep everybody muted until the end, and then we'll open it up for questions at the end. So it should take about 20 minutes or so to go through all the presentation itself, and then I'll open it up at the end. So HealthiestYou and with CornerStone. So you kind of know the partnership with CornerStone. We've had a relationship with CornerStone where we actually work with some of the same carriers. So a couple of different things that are important for you to know. Number one, we do not go direct to consumers. We only go through general agencies and agencies like yourself to go out to market. So you can know that your brokers can't come direct to us, and the clients that your broker serves will never be able to come directly to HealthiestYou, so we protect you there. But number two, we only have the partnerships we have with carriers are with Transamerica, United Healthcare, where we work with them and some of their products, but I know they're great partners of yours as well too, so a lot of synergy as well. So moving forward, the perfect storm has happened. Telehealth is really exploding around the country. We're excited to work with CornerStone and get this rollout to your field, to your agents and your groups. We've revised our pricing, so our pricing is very low, much lower now. And then you'll also see some of the tools we have are, if you've worked with telehealth or sold telehealth in the past, I want you today to kind of forget everything you know about telehealth and providers, because you're going to see today we're a lot more than that, and it's really taken off around the country. So HealthiestYou, what do? We like to view ourselves at HealthiestYou as not just a telehealth company. We like to view ourselves as a employee engagement company and a claims redirection company. So what I mean by that is we want to get people engaged in telehealth, but we want to be able to keep those claims, keep them off the major med, and really make an impact on that plan. So how do we do that? We start with telehealth and with the HealthiestYou, and one of the statistics that I have is that I like to start with is that according to the Wellness Council of America and the AMA, over 70% of the times that we go into person to see a doctor, whether it's emergency room, urgent care, or primary care, over 70% of those visits can be handled safely and effectively over the telephone. And that's where we come in. So the marquee part of what we do is telehealth. So you can, kind of the elevator pitch is, you can call up our service 24 hours a day, 7 days a week. We guarantee that a doctor will call you back within 1 hour, but in 93% of the cases, the doctor will diagnose over the telephone, and if necessary, they'll phone in a prescription any pharmacy you like. It's available in it's available in 48 states. Currently, we cannot prescribe in Idaho or Arkansas. Idaho, I think, is actually going to go back online in July 1st, but they're all U.S.-based licensed doctors. They're not doctors in a call center in India. They're not doctors straight out of med school. They average about 14 years experience. They need to be licensed in the state that the patient is calling them from. And we have all types of doctors on our network. We have a lot of primary care doctors, but we also have a lot of emergency room doctors, a lot of specialists like pediatricians on the network as well too. And we're proud to say we have by far the largest telehealth network in the country. Our competitors have anywhere between 300 to 500 doctors on their network nationwide. We have almost 2,400 doctors on our network because we give them so many consultations, and I'll kind of share some of those stats with you in a second as well too. So another question you're going to get is, well, this sounds great, but what can a doctor really handle over the telephone other than just sore throats and things like that? And if you look at the screen here, these are the top 9 reasons why we go in person to see a doctor. These actually happen to, they're almost identical to the top 9 conditions that our doctors treat on a daily basis. So you can see how you can get to a large number of those conditions safely and effectively by using telehealth. So one thing that we're passionate at HealthiestYou about is we want to make sure that we make you look good to your brokers, and we make those brokers look good to their clients out in the field. We know that the groups and the companies that you're going to put with us, these may be relationships that the brokers have had for years. So we want to make sure that those groups are happy with the service. They're going to use it. They're going to talk to their families or coworkers and be happy with the service, and it's going to spread like wildfire. So kind of the way a call works is they can either just call straight in, they can schedule an appointment online, or they can use our new smartphone app that I'm going to show you in a second as well too. But the first time they log in or they call, they're going to provide their medical history. So very, very similar to going into the doctor's office for the first time. So you're going to provide your name, age, your weight, drug allergies, past surgeries. All that's done first is stored in a HIPAA-compliant portal where the doctor, then they can access it every time. You don't have to keep doing that every time you call in. The triage specialist will ask you why you're calling in, the condition that you're calling for, and they'll schedule a call with an appropriate doctor. The doctor will review the patient's history prior to calling that member back. If a prescription needs to be sent in, they'll send it via e-script to any pharmacy. Doesn't matter. It could be a pharmacy by their house, by their work. If they're traveling, the doctors will pull up a Google Map search and find a convenient pharmacy. The doctor will then update the notes, and then we'll actually follow up with that patient to see how the consultation went, and we'll actually do a survey, and I'll share some of those results with you in a second as well too. So this is where I ask you to forget everything you know about telehealth, because typically in the industry, telehealth is a low price. They're going to mail, our competitors will mail out an ID card to the employees, and then that's pretty much the last you're going to hear of them. All of the communication, the education is put on either you or the broker or the HR director from that company. They're not really designed to drive utilization, and that's where the difference stops. So because of that, we know for a fact that our competitors have 2% or under utilization on their block of business. So what I mean by that is, so if you have a 100 life group, less than 2 of those employees with our competitors are going to be using that service on an annual basis. So we saw years ago, we've been in this space now for almost 9 years, and HealthiestYou has been around for about 3.5 years, and we saw a big flaw in that service and in that go-to-market strategy. So we really wanted to change that. So through the way we design our product, the way we educate our employees about the product and market it, we've changed that. So where our competitors have 2% utilization, in 2014 alone, on HealthiestYou, our entire block of business, we had 42% utilization. So another way to look at that is, what if you were able to redirect 42% of the times that the employees were going into the urgent care, emergency room, or primary care, and keep those off of their major med and have us handle those? That's what we do, and that's what kind of impact we have on our claims. So one way we do that is through our pricing. Our pricing is very, very simple. So we have composite rates. So on the 2 to 99 life space, we're at $9. Flat composite rate includes the employee and all of their dependents. Now the powerful part about this is that there's 0 consultation fee. So many of our competitors will charge anywhere from $20, $40, even $60 every time somebody wants to call in to access that doctor's. We've stripped that away, and we just do an all-inclusive composite rate where they're not coming out of pocket for any of their consultation fees. So we're able to drive utilization. So we actually then, it's very simple to quote it and to build it out to the field. If you get into larger groups, so 100 plus is $8 per employee per month, 250 lives is $7, 500 lives is $6, and then anything over 1,000, if you need to get it more aggressive on that price, and we'll get competitive and go help you win those deals as well too. So what we highly recommend, I'll show you some strategies about this in a second, but quote this on every group that's going out the door, quote it, and have ask the employer to pay for this. I'd say probably 90% of our groups, and so HealthiestYou is exploding. Last year alone, we had 500% growth. In January of this year alone, we brought on 2,000 new employer groups just in January. So we're just growing like crazy, and probably 90% of those groups had the employer was just paying for HealthiestYou as part of the benefit plan design. So we'll list bill that employer. We can either just collect hard checks from them, we can set them up on ACH, or we can get credit card from those employer groups to do this. If an employer says, no, I don't want to pay for this, but can you offer it at open enrollment, then you can go in and you can offer these voluntary rates. So it's $11 for an individual, $15 for a family, and we're still going to list bill that employer, and they can just payroll deduct accordingly for that group. So if nothing else today sticks with you, this slide, I would love for you just to kind of get this philosophy and get this go-to-market strategy. It's really helped out a lot of our general agencies around the country in terms of getting in front of brokers and closing deals. So if 70% of all the times we're seeing a doctor, whether it's urgent care, emergency room, or primary care, over 70% of those can be handled safely and effectively with HealthiestYou. Start with HealthiestYou. Don't put us buried at the bottom of the plan summary, or don't put us on page 5. Put us front and center. You can call no consultation fees. You can call 24 hours a day. You can actually sync your health plan and search providers, and then there's actually discount prescription savings built in. Now you build the rest of the plan around it. So whether it's major medical with an HMO or a PPO, you can raise copays or eliminate them altogether. You can raise deductibles. This is a no-brainer for HSAs or self-insured. So the goal is to take that major medical and free up enough premium to not only pay for HealthiestYou, but come in and pay for some ancillary products like gap, critical care, accident, even vision, dental, life, or disability. So our brokers who are doing this are not only freeing up enough money to pay for HealthiestYou from the major med, but pay for some supplemental products and still go back to that employer with either no increase on renewal or maybe even a decrease on renewal. So the employer is happy because you're actually breaking even with them or saving money on renewal. And the employee's happy because they're not seeing excuse me, a shift in the major medical as a takeaway, because now they have HealthiestYou where they can call a doctor free of charge 24 hours a day and maybe get in some other products. And the broker's happy because you're actually now increasing their commissions. We've seen a lot of examples where the broker is actually doubling their first-year commission because they're not only making commission off of the major medical, they're making commission with HealthiestYou and some of the supplemental. So you know, CornerStone, you're at our highest general agent contract in the country. You're at the top. Typical street level commission is 15%. So street level to the agents is 15%. If you have worked with your executive team, if you have an agency underneath you and you need to maybe give them a little bit higher contract, we can help you put them on 20-point agency contracts where the agency is making an override on the brokers too. And so I would recommend you talk to Steve and John and your executive team to walk through those scenarios. One of the things where we really put our money where our mouth is, we don't just say, okay, we're at 42% utilization and we're just going to get there somehow. We have a very, very concise, defined marketing plan. So yes, they will get a beautiful ID card from us mailed out. We contract with the same company that does the American Express Black Card, so they'll get an ID card with a name on there and information on how to access the service. But we don't stop there. We reach out to their team. So you know, we don't care if it's a 2-life group or a 20,000 life group. They're going to get a call from somebody from the HealthiestYou team, from our engagement and retention team, to talk to that HR director and welcome them to HealthiestYou. We're going to tell them about the service, how it works, when their employees should call and when they shouldn't call. And then the powerful question comes in, how can we help you communicate to your employees? And we'll ask them, for example, could we have their email addresses? We're not going to try to sell them anything. We're going to remind them that they have HealthiestYou and market to them and give them monthly emails from our libraries. For example, it's cold and flu season. You can call HealthiestYou free of charge. It's summertime. You're traveling. Remember, you can call HealthiestYou. We'll ask them, do you want worksite posters to put up or magnets to put in your work vehicles or on the refrigerators? We'll ask them if they want to do custom marketing. It's co-branded with their company, so we'll get higher participation. We'll do registration drives for the RX and to get them to register for our service. And then the 42% utilization I shared with you, that was before the app that we launched. So yes, everyone gets a beautiful card in the mail, but we'll also educate them on how to get into our new app. So this new app is amazing. This is basically everything that has to do with their health plan and their wellness all combined into one central app. So they download the app. It's available on either the iPhone or the Android store. They're going to set up everything in their app. So they're going to put in their information on their dependents, and then it gets really cool because they can actually sync their plan with their health insurance provider. So we have right now we have over 160 carriers with all of their plans built in. So they put in their member ID, and it's going to automatically sync up to all their network, in-network physicians. It's going to automatically sync up with their copays and their deductibles, and then everything works off of that. So one of the things our app will do is it will geo-fence. So basically, we've built in over 10,000 urgent care facilities. So if one of the employees on the plan walks into an urgent care facility, they're going to get a benefit reminder. It's going to buzz their phone, and it's going to say, hey, it looks like you walked into an urgent care facility. Did you know that HealthiestYou can most likely take care of this for you free of charge? Would you like to connect with the doctor now? Pretty powerful. Keeps that claim from them going to spend money in urgent care and keeps that off of their claim. The same thing will happen with pharmacies. So, for example, if they walk into a pharmacy, they're going to get a benefit reminder, and it'll say, would you like to shop at over 100,000 pharmacies? And we're going to beat copays probably 70% of the time. So I'm going to show you kind of the back-end engine of how this works. So this is where our members go to access telehealth, to get into wellness, to get into prescriptions. But if you look at a pharmacy here, well, I'm going to type in, I'll do Lipitor. I'm going to do, we're located in Scottsdale, Arizona, so it's 85255. And this is going to shop every PBM, every pharmacy, every grocery store, every coupon that's out there. So I shop Lipitor, 30 tablets, 20 milligrams, that automatically does generic. Shows you all the pharmacies in the zip code, but then it'll break down and it'll show you the lowest price. So this particular one came up. Walmart, it's $13.10. But this is where I want to really show you the transparency that comes through on our system, and this happens through all the different pricing that we provide. So, for example, if somebody walked into Fry's, which is a grocery store here in Arizona, and they were going to pay cash price or for this prescription, they'd pay $150 for that same prescription. With our system, it's only $13.98. If that's the one they want, they just click Get Free Coupon. They can print it, they can email it to themselves, or they can text it to themselves. The cool thing is that now we have this built right into our slide, or right into our app. So all that's going to show right up in their phone. They can save up to 85% on prescriptions. It'll show them exactly which one they want. They can click on it, show the pharmacist. They'll pay that cash price. So it'll save the employee money, but more importantly, it'll actually keep that off of the claims from the major medical as well too. Same thing built into our app is now, if you actually need to see, if you can't get your issue resolved with HealthiestYou and you actually need to see a doctor in person, now you can actually look at the doctors in network. So whether it's a primary care, pediatrician, specialist, dentist, eye doctor, it doesn't matter. They can look up in the system, find in-network doctors. They'll find star ratings, kind of similar to Yelp, so feedback from other patients to rank the highest doctors, and then they can actually go into our system and book real-time appointments with that doctor right through the phone app. They can actually price procedures on through our app too. So this isn't maybe this is how much you pay. This is how much they're going to pay based on their actual insurance plan built into here. So it'll show how much was submitted to the insurance, but then how much they're going to be responsible for depending on their copays and their deductibles as well too. This is a perfect fit for. We have plenty of full insured plans, but this is a perfect fit for self-funded ACA plans, so your metallic plans. This is a great fit to go alongside. I know I'm sure a lot of you are into doing MEC plans and limited med. This is a great fit to go in there, and even if you get in some larger groups like TPAs or associations, this is a perfect fit as well too. The next thing I'm going to show you is, like I mentioned before, we do not go direct to consumers, so we've had to build a lot of what we do around to support you as a general agency, but also support your brokers. So first of all, I'd recommend that everybody on this call go online and get your own HealthiestYou partner portal and train your brokers to do the same. It doesn't cost anything. It's all part of the tools that we provide. So you just go to HealthiestYou.com, and excuse me, you want to, members can go here. We have student groups. Admins can go here to manage their groups, to do adds and deletes and look at their invoices. But for our partners, like yourselves and our brokers, you just click on the partner tab, click on register, and you're off and running. Well, when you log in, you can, a couple different things will happen. Number one, it'll pop up and it'll say, get appointed with HealthiestYou, so you can get digitally contracted with HealthiestYou, so your brokers will know they're contracted under CornerStone and then they're digitally appointed. We actually offer our service now at a 30% discount to anybody contracted with us to get the HealthiestYou service. So they can just go on and enroll now and get the service. So when brokers, so imagine yourself as a broker going on here, it'll list the dashboard. So the number of deals they have in the pipeline, the monthly volume that represents, and then the tasks that are due with that individual group. So they can go on, they can see the groups underneath them, they can look at their commissions, they're off and running. Some of the tools that we have, there's email campaigns that are built in here, so you as a general agent, you can actually go out and invite your brokers to look at HealthiestYou and enroll in the partner platform, or your brokers can actually use our email campaign, and so they'll type in the name of the employer group that they're looking for. Maybe they want to do an introduction to HealthiestYou. All their information will be here. The email will look like it's coming from them, and they're off and running. Your brokers can also, so you can invite brokers to join a webinar, or the employer, your brokers can actually invite employers to participate in a HealthiestYou webinar. So they type in their name, their email address, and then they pick a webinar that they want them to invite. So they'll get an invitation from the broker, and then the cool thing is the system will actually notify the broker that that they viewed that webinar and for them to follow up with them. There's ROI calculators built into here, so if you get into some larger groups, we can actually use their claims data, show them information on how this could actually have an impact in their group based on their actual claims data for a particular group. So it'll actually break it down and show them the number of lives insured, claims redirection, and then what the ROI would be for that particular group, and how we can actually save them money. I don't want to spend a lot of time there, but I can actually help you do those as well too. Built into the system are proposals. So I'm sure everybody on the call today has a broker in mind or a group in mind, so I would love to help you build proposals and actually present to those groups and help your brokers get out there. But the proposals are really, really easy to build. So all I really need is the name of the group, the name of the decision maker, the effective date. Let's say it's 7/1 or 6/1, and then we just need the information on how many lives in that group. So the system's going to automatically price out. So let's say it's a 150 life group. The system will automatically price for that tier. But what it will do is it'll build a proposal for this group. So here's the decision maker at that group. Here's the name of the group. All the information about the broker, you can actually type in a little personal message there. But then here's the proposal. So built in as a video. It's about 4 minutes long. Talks about HealthiestYou and how it can help their employees. And then here's the quote. So this is a 99 life group, breaks it down. Here's the employee count, the monthly cost per employee. And now it gets cool because the employer can actually go accept that proposal right there on the spot. The broker will get notified that the client accepted it. It'll give them information on how to submit that group. They can request changes, so they can actually download that proposal. But built into here are all kinds of things. So real-world results examples. So how can telehealth or the wellness portions help their employee group is all built into the proposal. There's the cost of not having it. So going into an emergency room for all these different types of conditions, going to a primary care is what it would cost, or HealthiestYou free of charge. It's all built into the proposal system. Here's what we need to submit a group. So very, very simple. We need, everything is all right here. So you have all your sales templates, so everything, the benefit plan I just showed you, the presentation I just showed you, there's some case studies and sample utilization reports are built into there. But for the enrollment forms, very, very simple. All I need is the group app. So it's a simple one-page app with the information on the group, who the broker is, are we billing this group for a third-party administrator, how are we billing? Date of birth, their gender. If you can get it, we love their email addresses. Sometimes you can't, so we'll work with that group admin to try to get their email addresses so we can communicate effectively with them. And then their first month binder check, and that's really all there is to submit a group. It's very, very easy to do. The last part I'm going to show you is very cool. This is for, so all of you as CornerStone will have your own landing page, but your brokers can actually have their own landing page. So it'll have their name up there, the name of the agency, and then this is for employer groups. So how's the product work? Here's an overview, and then they can actually, the group can actually request a quote from that broker. They'll get notified that they requested a quote, and you can get that back to them. The other thing is, if you happen as an agency or your broker, so if they sell individuals, they'll have their own individual enrollment site. So once again, the name of the broker, the name of their agency, how's the product work, and then they can actually go enroll now. So the customer will type in their name, their address. They're going to put in information on them. Is this just for them? Is it for their entire family? It'll price that accordingly, and then they can actually put in their credit card information. They're going to get back in the mail. They're going to get the awesome fulfillment in the mail. The broker will get commission, and CornerStone will get commission for that group as well too. So that's the service. That's the products. I'm going to go through now. Give me a second. I'm going to go unmute and see if there's any questions on from the group. So hang on one second while I unmute everybody. Almost done. Hang on. Okay. Does anybody have any questions on the call today? Someone's got to have some questions. So you guys know, one of the things, number one, I've recorded this webinar, so I'll get that out to you all. But know that you're not out there alone. I'm here to support you. My sales team is here to support you. So that means building proposals for your groups, for your brokers. If you have agencies that you think would be interested in this and you want to help presenting to that agency and presenting to even groups, we're here to support you and help this roll you out to the field. So any questions on the product or the pricing, anything behind the scenes on how to submit a group?
You're far out, man.
Getting some feedback. So it doesn't sound like him. So I will. I've got all of your email addresses. I'm going to send a follow-up invitation, or so you can have. Once again, my name is Eric Cronengold. I'm Executive Vice President with HealthiestYou. I'm your main contact. So if you have any questions on the product, if you need any help, call me, email me. I'm going to get you as much as I can. I know you guys have already submitted a number of groups even before this. So we look forward to working with you, and it's just it's a great opportunity. CornerStone is a great agency, and we look forward to really helping you grow and help you build your business and get out in front of some more brokers. So thanks for your time today. I look forward to working with you all, and I'm sure we'll all be talking soon. Take care.